Director. That is correct. Right. Well, good morning, everyone. And the time is now 10 a.m. and I would like to call the inaugural meeting of the Alzheimer's Disease and Related Dementias Task Force to order.
Okay, so welcome everyone. I think we're still letting some people in, so we'll start getting them in as they wait in the lobby. As Alex mentioned, this is the Alzheimer's Disease and Related Dementias Task Force meeting. My name is Ursel Macker. I am the director of the Ohio Department of Aging, and I want to thank you for joining us today. Just a few things that are going to be really important for you to note. That the meetings do comply with public records and open meeting requirements. So meeting dates and minutes will be published at www.aging.ohio.gov. Again, at aging.ohio.gov. Also, it's important for you to note that the meetings are live streamed and open to the public on YouTube. We have a link available on our website as well as at the Ohio Department of Aging YouTube channel. A recorded video of today's meeting will also be available following. And so now at this time, I'd like to have Alex Lapso, our legislative liaison of the department, call the roll.
Well, thank you, Director. And again, good morning, everyone. For everyone's awareness, I will begin the roll call with task force leadership, proceed with governor's appointments, and then legislative appointments, and then finally representatives from executive agencies and offices. So with that, I will start with Chair McElroy.
Here.
Vice Chair McLeod or their designee.
Dr. Francis here.
Thank you. Good morning. Now on to governor's appointments. These will be called in alphabetical order by last name, beginning with Addison. Beach.
Here.
Blau.
Here.
Bolin.
Here.
Brockman.
Here.
Broad.
Here.
Berman.
Here.
Drost.
Here.
Hockwalt. Johnson.
Here.
Panka.
Here.
Mahajan.
Here.
Reese.
Here.
Russell.
Here.
Schiffel.
Here.
Smith.
Here.
Stevick Rust.
Here.
Thompson.
Here.
Van Ruenkel.
Yes, here.
All right, I will call the name Addison again.
Yes, here. Can you hear me?
Yes, Trey. Thank you.
Great.
Hockwalt. And moving on to our legislative appointments, I will begin with Leader Yuko.
I'm here.
Senator Wilson.
Present.
Representative Creech.
Here.
Representative House. All right, finally, I will call the names of representatives from our executive agencies and offices, beginning with Director Corcoran or her designee.
Here, and will be joined also by Isilda Dickerson.
Thank you, Director. Director Ashenhurst.
Here.
Thank you. And Ombudsman Laubert.
I'm here. Thank you.
All right, once more, I'll call the name of Representative House.
Our legislative aide, Kaylin Pittman, is on.
Oh, thank you, Kaylin. Director McElroy, we have a quorum. Thank you.
Okay, thank you. So again, welcome to everyone. Really excited to get this great work started. What I would like to do though is to introduce to you, or to yield some time right away, to Dr. Francis, who is representing, I understand, Director McLeod. The Ohio Department of Health is serving as the vice chair on this task force. So Dr. Francis.
Good morning, everyone. I'm honored to be joining you as the Vice Chair and designee from the Ohio Department of Health. Through both my personal and professional experience, I know all too well that, Alzheimer's and related dementias bring with them emotional, medical, and financial hardships. And with 220,000 Ohio adults aged 65 and over living with Alzheimer's, this equates to hundreds of thousands of Ohioans providing care to family members and bearing the challenges that come with this disease and related dementias. This highlights the importance of a public health approach in preventing disease and helping to advance the health of Ohioans. And I look forward to working with all of you to further this cause. Thank you, Director.
Thank you. Thank you, Dr. Francis. And at this point, I would also like to introduce Leader Kenny Yuko from the Ohio Senate, joint sponsor of amended Senate Bill 24. Leader Yuko, if you'd like to give us some remarks, please.
Yes, well, thank you, everybody. I apologize, I can't get online, so we have a video. I want you to know I'm wearing my purple tie. I got my Alzheimer's button on, and behind me is a End Alzheimer's Ohio Memory Day from 2019 poster behind me. I'm sorry, I can't share that with you. But I'm thrilled to be here with you nevertheless, and along with my good friend, Senator Wilson, who is my partner on Senate Bill 24, and the bill that created this task force. And please don't let that gray hair on both of us fool you guys. We're not here for just selfish reasons. We are very concerned about this. Hey, listen, the bill passed unanimously through every step of the voting process in both chambers. And we're so proud of the bipartisan support that we received for this task force. I also want you to know that we know how important this work is, and you don't have to let us tell us about it. We know. I look forward to learning from the experts and the community members here in this group, and please consider me one of your biggest allies as we move on with this process. I have personally visited dozens of nursing homes dealing with Alzheimer's. I've addressed numerous support groups and families and loved ones, and in every opportunity I've engaged in, it's taught me something new. I've visited homes, and one in particular that kind of brings back to my attention is when I rang the doorbell and a young woman answered the door. So I immediately says, "Is your mother home?" And she looked at me really confused, and I found out eventually why. She was the one who had contacted me to come and talk to her, and she was, I don't know her exact age, but her husband was 42 years old, and he had been diagnosed with Alzheimer's, something I didn't even know was possible at the time. I've also learned that Ohio is so blessed with so many facilities. They're phenomenal. They're well equipped. That they're staffed with the best of the best. They look fantastic. Unfortunately, my efforts with the support groups and the home visits often tell me I wish I could afford to send my mother or my father or my husband or my wife there, but I just can't. So we need to work on this too, folks. Providing health care is one thing. Making it affordable is equally as important. So I'm gonna get off and turn it over to my good friend and colleague, Senator Wilson. But thank you for doing this. I am thrilled like you cannot imagine that we're all getting this involved, and God bless all of you. Thank you.
Thank you, Leader Yuko. Senator Wilson?
Thank you. This is a matter of great concern. Was a matter of great concern when we passed the legislation, because as you know, Ohio is the only state without a comprehensive plan to handle Alzheimer's disease and related dementia. It has become much worse. The pandemic has done two things to us. One, it has taken the attention health-wise off of this great problem. The second thing that it has done is that I think when we do the counts coming out of the pandemic, we're going to find that a lot more people have either for the first time experienced or their dementia, their Alzheimer's has become much worse because of the pandemic. The isolation that they have endured, have needed to endure during the pandemic, has just many times over accentuated the problem. The goal of this is a report that will lead to an Ohio policy that guides the necessary legislative action to address this problem. This is such an important task force. I hope soon we can all be together, not by video or audio conference, but together in the same room to begin to work on a report that will be comprehensive enough that it can lead to a policy so that we can then begin to pass the necessary legislation to support the caregivers, to find cures, to come up with a way to finance the incredible cost that is going to come upon us as we go forward and this problem grows within our great state. We owe it to the people of Ohio to do a great, great job on this report. This committee doing the report sunsets, as you all know, with the issuance of the report. It has got to be so compelling that we can take it forward into a policy. I thank each one of you for being willing to serve on this, and I challenge each one of you to put extreme effort into making this a report that will guide Ohio into the future. Thank you very much.
Thank you, Senator Wilson. Again, we appreciate all of the efforts and work that both you and Leader Yuko did to get us to this point. So thank you so deeply. Thank you. I'd like to now also introduce Trey Addison, Director of State Public Policy of the Alzheimer's Association. Trey.
Yes, thank you, Director McElroy. And it was an honor and a privilege to work with you, as well as Senator Yuko and Senator Wilson. I ask that the task force from the Alzheimer's Association standpoint think big, think creative, and think solution-oriented to help all those individuals, caregivers, and those living with Alzheimer's and dementia. As we move forward and work on these issues, the number one thing that we're thinking about is how do we focus on early detection and prevention? The earlier that we can look at this disease and take care of it, the better off we will all be long-term. As an association, we've watched state plans across the country pass, move forward with the lack of execution on the long term, and then have to come back and reconvene. Luckily in Ohio, we've got great leadership leading the task force, and I guarantee you, we will move whatever legislative opportunity, regulatory opportunity, so on and so forth forward to help the 200,000+ individuals living with the disease and the 1 million+ caregivers taking care of those individuals. So thank you, Director, for giving us the time, and we look forward to rolling up our sleeves and getting to work.
Absolutely, absolutely. And it has been a pleasure. It was one of the, I think, early things I did coming in was to connect with the Alzheimer's Association. I see you there, Ms. Blau. I mean, I had a chance to come and meet you all. And so just know that clearly we are sort of locking arms, if you will, to address this this just undeniably huge problem that we have not only within our state, but across the country. So thank you. I'm really glad to have you all here. So with that, I would actually like to turn this over to Alex. He is going to facilitate more formal, if you will, more broad introductions of each person so we can get to know a little bit about you, your position, and your interest in the task force, and then how you'll support the mission. So Alex, I'll go ahead and turn this over to you.
Well, thank you, Director. Appreciate the opportunity to facilitate these introductions. I will again go in order as we did with the roll call. And just to reiterate what the Director said, we'll ask for your name, for you to provide your current position or title and the association that you're with, if necessary, and as needed. Also, your interest in the task force, and finally, how you both personally and professionally may be able to help support the mission of this task force. So I will begin with Chair McElroy.
So again, Ursula McElroy, Director of the Department of Aging, interested in this task force because of the many lives that we can impact now, and perhaps the quality of life we can restore, and not only for those now, but for those to come. We have so many people who are significantly impacted by this disease, not only those who are directly affected, but the caregivers and loved ones who also have to sort of stand in the gap for these individuals. And so how I will support this mission is to dedicate our staff, our administrative support behind this, to serve as the best leader I can in collaboration with you on this topic, on this effort. We've even taken some steps in advance of this meeting to try to be sure that we have the infrastructure in place to be as supportive as we can. And so as we begin to meet more often, I think you'll be able to see some of the things that we've done in anticipation of and what we will continue to do throughout. So just really excited to be here.
Thank you, Director. Moving on to Vice Chair Francis.
Thank you, Alex. I think most importantly, you heard a little bit about just kind of a brief overview at the opening, but most importantly for me, this is kind of a happy result of the pandemic that I get to join you all on this committee. This is a topic that's very close to my heart. As an ER physician, some of the most beloved patients that I've ever had are those with Alzheimer's and related dementias, and supporting the family around their loved family members and the resources, you know, I know are few and far between when it comes to those kind of situations. So I'm so glad to be able to join and work on this topic, not only with that experience and personal experience of having a family member going through this who was once, you know, a very high functioning judge here in Columbus, and then, you know, was able to see firsthand the effects that this has on all of us. So I am excited to have the partnership with everyone here in order to expand my knowledge and then bring forth the Ohio Department of Health as a partner to address this topic statewide. Thank you.
Thank you, Dr. Francis. At this point in time, I'll now proceed through the governor's appointments, again in alphabetical order. This also provides you an opportunity to correct me if I mispronounce your name, or if you wish to be called by a different name. So by all means, please feel free to correct me at this time so our records can reflect that moving forward. I'll begin with Trey Addison.
Thank you, Alex. Trey Addison, Director of State Affairs for the Alzheimer's Association. Professionally, I think ultimately our goal and intention, as it is across the country, is really to zero in on early detection, prevention, and of course, ensuring that caregivers have all the resources they need to take care of their loved ones. As we look at this from our vantage point, all the resources that the Alzheimer's Association has from a national and global scale, this task force has through me and my appointment on the task force. So we see this as a great opportunity to collaborate with partners, some we've worked with, some we have not, and really move the issue of Alzheimer's and dementia forward. From a personal standpoint, my family has dealt with this and we are currently dealing with this. So not only is it close to the heart from a professional standpoint, but it is also personally. So thank you, and look forward to working with everyone.
Thank you. Doug Beach.
Let me get unmuted here. Thanks, Alex. I really appreciate the opportunity. My name is Doug Beach. I am the Executive Director of the Western Reserve Area Agency on Aging. There are 12 area agencies on aging throughout the state, and my area agency is in the greater Cleveland area. Interested in the task force, again, like, well, I guess I ought to mention that I am current president of O4A, the Ohio Association of Area Agencies on Aging. My interest, like so many of those you've already mentioned, is personal. Family members that have had dementia, family members that have had dementia that were misdiagnosed, family members that had dementia that were put in situations that they probably shouldn't have been had we done the diagnosis properly. So we're going to look and push for making sure that we get the right information out to our docs and our nurses and the whole medical field. I think our greatest contribution, though, or my greatest contribution, is we are an organization that focuses on advocacy. We've done quite a bit of work with Senator Minority Leader Yuko. We've also done quite a bit of work with Representative Stephanie House. Great members. Anytime we can do something that moves the ball down the field with the two of them, we're more than interested in doing so. Appreciate the opportunity and thank everybody for letting us on this group.
Thank you. Jennifer Blau.
Well, good morning, everyone. My name is Jennifer Blau, and I am a care partner to my husband, Rod, who has been diagnosed with young onset Alzheimer's and Lewy body dementia. So we are currently walking this journey through the disease and utilizing a fair amount of help across the Columbus area in particular, and the different medical systems available to us, as well as the Alzheimer's Association. So I think my interest probably speaks for itself just in that caregiver role, but my purpose for wanting to be a part of this and what I think I bring to the table is a real connectedness with the Alzheimer's Association and advocacy programs, educational programs, and general communication. My husband and I both are state and national advocates with legislative members. We both serve on various task forces within the Alzheimer's Association for caregiver support, dementia nomenclature, and other medical type of reviews, research. Additionally, I serve as the caregiver member on something called Project ECHO, which is an Alzheimer's Association project that reaches out to primary care physicians, including actually several hospital systems here in Ohio, and pairs them with experts on the Alzheimer's disease. And we go through education with the primary care physicians, as well as we also do case studies with them. So we actually review specific patients that they are dealing with. So I have a lot of connections with professionals dealing with the disease, and I'm walking it myself. And I'm just really delighted to be part of this and look forward to working with all of you. Thank you.
Thank you. Sally Bolin.
Good morning, everyone. My name is Sally Bolin, and I'm so pleased to be part of this task force. Thank you. It's an honor and a pleasure to be here. I have a couple decades worth of experience as a clinical social worker, working in the field of aging in nursing home, hospital-based, and community-based services since the mid-1990s, primarily working with family caregivers, older adults, and older adults with various types of dementia. So I'm excited to be here, and I liked what Doug had said about being part of this to move our efforts down the field. It's exciting to be here. When I was first cutting my teeth in this arena, Barney Quilter and Dave Hobbs had started the Alzheimer's respite line item in Ohio, which was one of the first, to my understanding, line items that provided direct funding to support respite care in the state, which was pretty exciting to be part of. And I was very, I think, wide-eyed and learning much at that point in time, although I still learn every day. And then I know Director McElroy and I worked on, it was a while ago, but the Silver Alert program and introducing that to the state. And so it's neat to see what our next steps will take us on as we continue to move forward. And there's been lots of wonderful efforts in between. So I'm glad to be here. I think professionally, I can bring my experience just working in the clinical setting. I've been involved in the rollout of several dementia-specific evidence-based programs in Ohio, which have been exciting to be involved with. And I have a personal connection with the disease with several family members who have lived with it, with my mom passing away this past year. So it's very near and dear and personal and close to my heart. So thank you very much.
Thank you. Lisa Brockman.
Hi, I'm Lisa Brockman. I'm the administrator at the Alois Alzheimer Center in Cincinnati, Ohio. So my interest is fairly obvious from that point of view. The Alois Center is the first facility of its type to focus specifically on long-term care for people living with Alzheimer's and related dementias. So we've been doing it for over 32 years and have enjoyed creating best practices for this population when they move to the place where they require long-term care, and continuing to do that over the last 3 decades and moving it forward into the future as well. I think, so bringing that current, talking to families, talking to residents, talking to frontline staff every day, I think will be how I can support this task force and help move it forward. I'm excited about the idea of making a bigger difference, right? So I get to have a pretty heavy hand in what we do here at the Alois, both with our center and with our foundation, reaching out and doing a lot of outreach locally and education and that kind of thing. But really moving it to the state level so we can start having best practices in place for long-term care for people living with this and their caregivers across the state.
Thank you. Catherine Brode.
Well, good morning, everyone. I am Catherine Brode, and I'm the president and CEO of Leading Age Ohio. And Leading Age Ohio is an association of aging services providers that range from adult day, hi Sally, to hospice and everything in between, including affordable housing. And so while my personal life, it's probably rare that anyone hasn't had a connection in some way, shape, or form with Alzheimer and other dementias. The opportunity to work with our Leading Age Ohio members has just been incredible for me to understand how they're connecting with their communities. And so most of them are not-for-profits that have been around for a very long time. My favorite story is one of our not-for-profits describes they were functioning when Abraham Lincoln was elected president. They've been serving their communities for a very long time. And so they're serving, I bring that up because they're not only serving within their walls or perhaps with the services they're providing, but because they've been a part of their community so long, they're connected with caregivers with needs. They're connected in the banks and in the grocery stores and and restaurants and libraries. They're working to create an understanding of how the community can engage with the needs of those affected by Alzheimer's and other dementia. So the opportunity to see what they're doing is exciting for me. And so I pledge to bring as much of that experience as I can, because I believe that they've been innovative in a lot of their work. And I'm excited about this group because I believe that this task force that we're on is going to deliver a powerful report. And to the extent that I can bring that input from those with whom I work, I will be pleased to do so. So thanks for this opportunity.
Thank you. Bonnie Berman.
Hi, everybody. I am Bonnie Berman, and I am the president of the Ohio Council for Cognitive Health. And I'm thrilled to be here with everyone, since we do represent a kind of small, growing organization. We like to think of ourselves as small but mighty. And in the mighty part, we work with most everyone on this call in 5 ACL grants. And we're really excited about the way Ohio has been honored to have all of those grants. So we are able to bring information from all of those partners around the state to this wonderful initiative. I think the most important thing that we can bring to the task force, there are two things. The first is that we believe that there is always something you can do to make life better for somebody who is living with or impacted by dementia. And when we say impacted, we of course mean the care partners and caregivers as well. And the second, to reiterate what Catherine and Dr. Francis said, is that we are firm believers that this is everybody's issue. And the partners that we work with around each community and state, from the schools to faith-based to the ones that Catherine mentioned, they all have a role. And so our goal with Catherine will be to continue that public health or population-based approach to involving everyone in the community in this initiative. So thank you.
Thank you. Jennifer Drost.
Great. Good morning. I'm Jennifer Drost. I am actually a geriatrician here in Akron, Ohio. And while I see kind of patients and interact with their families across the care spectrum, from outpatient office and in the hospital, my primary role really is in home-based primary care. And a large portion of what leads to people being homebound is cognitive decline and developing Alzheimer's or other dementias. In that role, though, I get to opportunity really to work hand in hand, not only with those individuals, but also their family members or their family of choice that's providing the care for them. And it's not infrequent that I hear, you know, if we'd only known, if we'd only known the diagnosis, if we'd only known what it could have led to, if we'd only known what services and supports are available to us, it would have saved, you know, sometimes years of heartache for these individuals. And so I hope to bring that to the task force, that as we've heard from several people, that pushing the diagnosis, the identification, the knowledge of supports, the building of supports upfield or downfield in individuals' lives, so that they and their families have the care and support that's needed in order to let them continue to live active and healthy lives for as long as possible in the community. So I'm thrilled to be a part of this. I am thrilled to have the opportunity to continue to learn from everybody here as well, and hopefully lend my voice to this work.
Well, thank you. Rhonda Johnson.
Hi, I'm Rhonda Johnson. I have served as the South Chair for the Ohio Occupational Therapy Association the last several years. So an occupational therapist that has worked for the last 10 years in geriatrics, with my focus being on dementia and Alzheimer's. My mother was diagnosed with early onset at the age of 61.
Excuse me for one moment, Rhonda. We're having some difficulty hearing you. Are you able to potentially turn up your volume?
Is that better?
Yes, I can certainly hear you better.
Okay.
Thank you.
That's okay. As I said, my mom was diagnosed at the age of 61 with early onset Alzheimer's, and we were fortunate enough to be able to keep her here at home for the 11 years that she lived with the disease. She passed away this last year in May. My goal for being a part of the task force is I'd like to look at increasing education for caregivers, both in the home and within the facilities. I've worked in skilled nursing facilities for the last 10 years, and we definitely need increased education all the way around for the staff in those facilities. I don't know, from my personal experience, I just would like to do anything and everything that I can to try to help this task force and to better the lives of those living with the disease.
Thank you. And we extend our condolences to you and yours as well. Diane Panka.
Good morning. My name is Diane Panka. I am the statewide volunteer advocacy lead for AARP Ohio. I know that's a mouthful. Basically, I'm the volunteer who does the most with advocacy in the state. And it occurs to me, especially after listening to everyone who preceded me here in their introductions, that my experience with Alzheimer's and dementia is almost non-existent. And I would say as a result that my purpose here on this task force is one, of course, to bring the resources of AARP, which is a national organization, which has a lot of resources in terms of experience and analysis, and of course a lot of members who themselves have experienced Alzheimer's and dementia diseases. But really it seems to me as though my experience, my reason to be here is more to be someone to be educated and to give the perspective of someone who does not have much experience here in the public. And however, I'm given this opportunity to sit in, to learn, and to ask what may often be those strange, stupid questions, which I'm more than happy to do, as long as you're all happy to deal with me and further this work that I'm sure is incredibly important. So I really appreciate the opportunity to be here and to have been appointed to be on this task force. And I look forward to bringing the naive and yet heartfelt, willing to work attitude that I'm sure will be needed by everybody on this task force.
Thank you. Varun Mahajan.
Hi, good morning, everyone. My name is Varun Mahajan. At the state level, I serve as a board member on the Ohio Commission on Minority Health, as well as most recently, the Ohio Minority Vaccine Task Force. Privately, I am Chief Executive Officer at Mahajan Therapeutics, which is a mental health and drug addiction company in Ohio. I am also a practicing breast cancer radiologist. Personally, I have a father who is in his last stages of progressive supranuclear palsy, so understand the various components involved with anyone with a difficult to diagnose and treatable and poorly treatable neurologic disorder. Why am I excited about this task force? Well, you know, the national academic environment has improved its support for detection and prevention. I mean, one need not look any farther than Richard Isaacson and his work in New York. I would like to leverage evidence-based medicine and help apply that in innovative ways to Ohioans. So we're not just reinventing the wheel, but we're starting to change outcomes and we're supporting our communities at the same time. I mean, basically, how can we translate cutting-edge Alzheimer-based medicine and deliver it to Ohioans and support them in a public policy perspective? So I'm thrilled to be part of this task force, not only to improve early detection campaigns, but also bring awareness on how to do that. Thank you.
Thank you. Pam Reese.
Good morning, everyone. My name is Pam Reese, and professionally, I am a registered nurse. I spent the first 15 years of my career going through different positions within the industry of skilled nursing, assisted living, memory care, and rehab. Went from a director of nursing, district director, regional VP, and then spent the last 15 years of my career as a owner partner of a company that owned 42 facilities. In my positions, I was responsible for the care and services of those living in memory cares. I developed memory care units. I developed policy and procedure based off of evidence-based practice, worked with families, and of course, educated staff. In 2018, I retired my partnership and I transitioned from the provider to the caregiver. And as all of us being affected by someone with Alzheimer's, my mom had Alzheimer's, even though her whole entire life she had told me that was the one disease she would never get, she did. And I truly entered that journey thinking that I could cure her, thinking that I could be her best resource, having all of the resources that I had enjoyed in my collaborations throughout my career, and quickly learned that the job of the caregiver of a loved one with Alzheimer's, you cannot prepare for it. And in that quest of wanting to take care of mom at home with our family, building her an apartment, going through all levels of care and services, ultimately we did have to choose a memory care. And in my path, I realized that the emotional needs, the physical needs, the support that the family caregivers need was outstanding. I also came to realize very quickly that all my years of thinking I really knew what I was doing with Alzheimer's and developing programs, that maybe I didn't. And so I developed a company called Quality Now that works with family caregivers of loved ones at home with Alzheimer's and related dementias, and in trying to make their journey as easy as possible, if that's even possible. I also work with memory care facilities and skilled nursing, and especially through COVID right now. And I agree that the impact for the Alzheimer's patient and cognitively impaired has been just tremendous. So I'm honored and privileged to be a part of this task force. Personally, I would love to bring knowledge of the industry that serves them, and what can be done in that arena to make care even better. Education is a big deal. Commitment is huge, but also the extended resources that are needed for those loved ones at home, but also to support them as they make a tough decision about sending mom, dad, or a loved one to the nursing facility, to the memory care. That's is daunting as it is taking care of their loved ones. And so again, honored to be here. I look forward to working with each and every one of you and making a wonderful impact. Thank you.
Thank you. Joe Russell.
Thank you, Alex. And hello, everyone. My name is Joe Russell. I'm the Executive Director for the Ohio Council for Home Care and Hospice. We represent home care, home health, hospice, and palliative care agencies all around the state of Ohio. Professionally, our members are very, very interested in this topic just based on the sheer number of people that they are now serving in the community that are afflicted by some sort of dementia-related disease. Many of our programs have developed some type of training for their staff. although it varies across the state. And so what we would like to really see is, as already been mentioned by several other people, is some additional education tools that we can provide to both family caretakers as well as professional agency caretakers, and hopefully maybe develop some evidence-based standards within the community for these programs. On a personal basis, I too, just like so many of you, have had experience with family members and have seen firsthand what it takes to take care of loved ones in the community. I think one of the challenges that I've witnessed is, there isn't a sort of standard journey for folks that are afflicted with this. You could be in stage 1 for many years and then all of a sudden decline rapidly. So that makes it extra challenging for us. But I think, and then unfortunately over the holiday break, we learned that my uncle, who's 65 and he has Down syndrome, has been now has Alzheimer's. So that's been challenging. He had a very severe bout and was hospitalized with COVID, but thankfully he survived that. But so my family unfortunately is going to have to go through this again. And so really looking forward to adding value to the group where I can. I'm very, again, excited and humbled to be a part of this thing. And hopefully we can come out of this and all say that we've done some good things for the people of the state of Ohio. So thank you, Alex. Appreciate it.
Thank you, Joe. Melissa Schiffel.
Thank you. Good morning, everyone. My name is Melissa, and my involvement in the task force is probably threefold. First of all, my mother has been diagnosed with early Alzheimer's, so I am helping care for her. However, I would say helping care for my dad, who is her primary caretaker as well. My parents are in their 70s, and so I see some hopefully added value from my perspective as I care for a caretaker who is part of a generation that is very proud, is sometimes doesn't know how to ask for help or where to look. And that is something I think this task force can help, especially so much is available at our fingertips on the internet, but there are certain generational prohibitions to accessing that information. Professionally, I am the Delaware County prosecutor, and I've spent my career prosecuting criminals. And that includes the people who have taken advantage of our elderly. And we see specifically a lot of crimes involving Alzheimer's patients and dementia patients who have been taken advantage of. And this is very near and dear to my heart. We recently just had a case where a woman worked in a care facility. She stole from multiple people, and an individual had to be buried without his wedding ring. And so I'm very passionate about making sure that the tools are in place for our prosecutors and our law enforcement to hold these people accountable. Thank you.
Thank you. Leanne Smith.
Good morning. I just also thank you so much for the opportunity to serve on this task force. Again, my contribution, I hope, will be also at least, double-fold, I guess you'd say. My mom struggled with Alzheimer's for over 9 years. She passed away about 2.5 years ago. Also was her main caregiver along with caring for my dad, same type of situation. So it is a cause that is very near and dear to me, and it's been something that I've hoped that in some way I could contribute down the road and offer my experience and learn a lot more, but also contribute in some way to bring more education and more awareness to this horrific disease and these dementias. Professionally, I am the Director of Residential Services and Public Relations here at a continuing care retirement community in Tiffin, Ohio. So I have been in this industry for over 22 years, and so I see it on the facility side. I see, in my opinion, a great need for staff training and education for those that are on the front lines caring for these people day in and day out. They're angels, they're saints, but they also need, I think, a few more tools to help them understand the disease and know just who they're dealing with on a daily basis. So I'm hopeful that through some, just different meetings and getting to know all of you on this task force, that also will be able to contribute a tremendous amount of information for the state of Ohio. And again, I'm just so honored to be able to serve. Thank you so much.
Thank you. Lori Stevick-Rust.
Good morning. My name is Lori Stevick-Rust, and I'm going to echo what many have said already, which is it's really a privilege to be part of this task force. As I'm listening to the background and the experience of so many of you, I think we have an opportunity to do some great things. I am a clinical health psychologist and have been working in the field of senior care and dementia care for the past 30 years, mostly doing work on the acute care side in the healthcare systems, but also in the post-acute care world across the country, providing education and support for both our professional healthcare workers as well as our family healthcare workers. I echo again what many have said, which is the fallout here, I think, for our healthcare systems is we're not getting enough education in the hands of our healthcare workers, our primary care doctors, making sure that the diagnosis is not only given in the chart, but given to the families as well. So often families walk away going, okay, they kind of said dementia, but I really sort of don't know what I'm supposed to do next. And then the cascading effect of trauma and struggles that ensue is heartbreaking. And now, of course, I'm providing some consultation on the global level with Sodexo, who many of you may know is a large provider for dining services, recognizing from my perspective that everybody who has a touch point with seniors who have the diagnosis, the comorbid diagnosis of dementia, have to be educated and have to understand the behavior and the symptoms in a way that they can feel like they can make a difference and have impact. So again, my ultimate goal in participating in this team is really trying to advance the education and the support of our healthcare system workers who have to, clearly we have much work to do in making an impact in early diagnosis, accurate diagnosis, and follow through treatment plans for our families. But then also I tend to train around a holistic model that dementia is not just, as you all know, about short-term memory loss. And yet so often it's kind of written off as, oh yeah, I know about dementia, it's that memory problem. Not understanding the medical complexities of this disease. And I think we can make great strides in doing better advocacy by doing better education and better support to the people who are really struggling out there. And I will add that because I run a lot of support programs, when people knew that I was going to be part of this task force, they kept saying things like, make sure they know that we're suffering out here. Make sure they know that we need better education, better guidance, better tools. And COVID, of course, has just added insult to injury here. As many of our healthcare workers are trying to be the surrogate family members, have much trauma of their own as they're the ones holding the hand of the people who are dying for families who can't have access. All of the stories that I know you guys all know who work in this industry. But I think now more than ever, because we're under this pandemic, it gives us an opportunity to see the cracks in our healthcare system and how we can do a much better job in providing good care, keeping the dignity of our seniors who are struggling with this disease, and advocating and supporting their families and the healthcare professionals who are trying to provide services. So again, I am thrilled that as I'm listening to everybody, I'm hearing the same themes. It sounds like we're all coming at it from a little different angle. And to our prosecutor, yay, again, exploitation of our seniors, we need a strong advocate in that arena as well. So I am privileged and thrilled to be part of this task force, and I just am confident we will do some amazing things going forward. So thank you.
Thank you. Jean Thompson.
Thank you, Alex. My name is Jean Thompson, and I'm the director of the Ohio Assisted Living Association. I've been so since 1993 at its inception. And in the beginning days, we were obviously a small part of the long-term care continuum, but now we represent a really significant part of that long-term care continuum. There are 782 licensed assisted living communities in Ohio. And I watched over that period since 1993, the growth of dementia care within our industry and the need in our society. I'm thrilled by the comments earlier on, I think, that explored the idea that this group is not going to look at this just as a long-term care or a respite or a guidance to family caregivers, etc., but as something that's a societal issue, that if we educate at some level everyone a little bit about dementia, at least, it means there'll be better encounters in the supermarket, better encounters in restaurants, as I think was suggested. But I also think if we do a little bit of that in schools, it will really even help the long-term care continuum, because maybe it will interest young people in careers, in caregiving, etc. And that's an issue that we really are going to have to deal with at some level in this task force report. And that's the shortage of care staff on the facility level, and I'm sure certainly for individuals at times. So I would like to see us, I think those are exciting concepts, to be able to make a world friendlier to dementia, or at least a state friendlier to dementia here in Ohio. I'm also very interested in the concept that was mentioned earlier on, that we have to be aware and know that we're going to have to, as a state, make a real investment in this care. It is expensive, and I think at times that's a piece that's been missing. And I look forward to working on that and to sharing my knowledge of assisted living, to learn best practices from others, and to help us all move forward on this really compelling issue. It certainly is my pleasure and honor to serve on the committee, and I look forward to it. Thank you.
Thank you. And last, Pete Van Ruenkel.
Good morning, everyone, and thanks, Alex. My name is Pete Van Ruenkel. I'm with Ohio Healthcare Association. I've been the executive director there for a while. And we represent 1,100 roughly members who provide a variety of long-term services and supports, including services for people with intellectual and developmental disabilities, who, as I think Joe Russell mentioned, also can end up with dementia and need to be considered in this whole process. But overall, we have a broad representation of providers, and they bring quite a lot of experience in this area. And so I look forward to working with the group in developing policies. Obviously, as Senator Wilson said, Ohio is a little bit behind the ball as it relates to having a coordinated planning for services for people with dementia. So that's an exciting thing to be a part of. Like so many of you, like I think pretty much everyone so far, I also am a consumer in a sense, in that my mother currently has dementia and COVID at the same time. And is an assisted living resident. So I spoke with her yesterday by FaceTime, and it's challenging. It's a rough situation, as everyone here knows, because that's why you're here. So we look forward to working together and coming up with solutions.
Thank you. We'll now move on to our legislative appointments. We have previously heard from Leader Yuko and Senator Wilson, but we would like to extend the opportunity for them to, again, introduce themselves as appointed members of this task force, beginning with Leader Yuko.
Well, thank you again, folks. You know, this has been something that's been an ongoing experience for me since Senator Wilson and I started having our initial conversations. As I indicated, I have visited nursing homes. I have visited support group meetings. I have made personal home visits to talk to families. I've also talked with law enforcement about other issues. And when I talk about other things that we're working on, this subject comes up because they often tell me that, you know, we've had an experience or two in our departments where a gentleman might be walking through the neighborhoods and looking in like windows, and next thing you know, the policeman will come by because they get a phone call about peeping Tom, and they'll ask the guy his name, and he'll give his name, and they'll ask if he has any ID on him, and he reaches in his wallet, and his wallet has a different name or a different address that he has on him, so they immediately think he's up to no good. The reality of it is this guy's nervous, he's scared because he forgot where he lives, and again, we need to, besides the sensitivity training for our doctors and attending physicians, but we also need it with our law enforcement too. So I hope that doesn't get lost on this task force, that Alzheimer's, it can affect our entire community in so many different ways. So we have to keep that on our forefront in our minds. It's a tremendous responsibility. We have an aging population. I'm part of that baby boomer generation right now. I'm 70 years old. I'm seeing more and more of people my age that are being diagnosed with Alzheimer's, as I indicated in my earlier remarks. The first time when I met the young woman whose husband was 42 years old, I didn't even know that was possible. You can have Alzheimer's at that age, but apparently it is. So again, it's just the education that we're being charged with. Besides finding answers, we have to make sure we do our best to communicate our concerns with all of Ohio, and not just with those immediate families, because if it hasn't impacted your family yet, it may in the near future. So again, thank you for everybody being part of this task force. I'm so proud of every single one of you. I love hearing your stories. I love hearing your commitment, because I know we are on the right track to get this thing done. And again, I'm going to give a special shout out to my good friend, Senator Steve Wilson. I could not have asked for a better partner to team up with me and make sure that this tremendous task that we've been afforded the opportunity to serve with is fulfilled, and that we do it in a very meaningful and positive way. So thank you, Steve, for everything, buddy. I love you. And to all of you, God bless you. Thank you.
Thank you, Leader Yuko. Senator Wilson.
Thank you. And I can't say enough about my partner. Being bipartisan in nature with this task that we took on has been so very helpful. I came to Columbus not having much understanding of the political process or being a politician, because I was 4 years a naval officer and 45 years a banker, and retired and then flunked retirement. So I also am 70 years old, and that's one of the reasons I care. But there's a lot more to why I care and why I think this is important. I went to Columbus with several things in mind. One of them was aging issues. To the prosecutor, my elder fraud bill has made a difference, I feel. This Alzheimer's bill will make a difference, and that's why I'm there. I've had experience in aging issues because it started with my connection with Otterbein retirement communities, and my grandfather 30 years ago died of what they called hardening of the arteries back then, but the net result was he had dementia. And I started caring that 30 years ago, and that carried on to my mother and father, who have been at Otterbein. My father has passed away. My mother's 94, and she's beginning to experience some memory issues. So that, and then the fact that I married Jill Wilson, who in fact is the CEO of Otterbein Retirement Communities, and has worked 24/7 ever since COVID to protect her 7,200 elders at her 20 locations and her 2,700 partners or caregivers. And so we talk every day about these issues and about the challenges that she faces with dementia, Alzheimer's, and memory care. So I care. I am so thrilled that this group of people has been put together. I think together we can make a difference. Together we can put a report out that leads to a policy, that leads to legislation that helps with these issues for the people of the state of Ohio. Thank you very much.
Thank you, Senator. I would now like to offer the opportunity for our appointments from the Ohio House of Representatives to introduce themselves, beginning with Representative Rodney Creech.
Well, good morning. My name is Rodney Creech. I'm newly elected to the legislature representing the 43rd District in Southwest Ohio, and very excited to be here. One of the things that I wanted to be able to do when I went to the state was represent the people. And over the last 5 years, I've been very heavily involved in our Council on Aging, very active board member, and Speaker Cupp recognized that. And I'm thankful to be here because the aging population is near and dear to me. Just like everyone on the call, I have had family members in the past that have been affected. And I remember when I was a little kid, going and seeing my great grandma every Sunday, and couldn't understand why we were talking to her about things when she was a kid. And but that was how my family related to her. And watching that growing up, I just recently had a grandma a few years ago that was affected again. I'm a farmer by trade. I don't deal with this on a professional level like most of you, but I do have some personal experiences and the passion that it's going to take to be an active member on this task force, and I look forward to working with all of you.
Thank you, Representative. And Representative House, it's my understanding that you were able to join us. Are you there?
I am. Good morning. Can you hear me? No.
Yes, we can. Absolutely.
Oh, okay. Good morning, everyone. I'm Representative Stephanie House. I am just excited to be on the task force with everyone. Everyone has said everything, so I'm just glad to be here and looking forward to serving.
Thank you, Representative. I'll now proceed with offering our representatives from executive agencies and their offices the opportunity to introduce themselves, beginning with Director Corcoran.
Thank you, Alex. In addition to my work with the Department of Medicaid, I too have some personal experience that bears on this area. I'm a nurse by training, and I also have family experience with caring for a loved one at home, as well as we've experienced the full continuum of independent living, assisted living, skilled care, and more recently, a tragic experience with someone who was much younger who had the disease. So I, join my voice with all of yours as we try to deal with this. And I do want Isilda Dickerson is with our team, and Isilda, would you also introduce yourself?
Yes. Hi. Good morning, everyone. I'm Isilda Dickerson, and I lead the team of long-term services and supports committed professionals in the Department of Medicaid. And in our roles, we are here to ensure that individuals and seniors receive the quality of care that in the home and community-based settings, as well as in nursing facilities and other long-term care facilities. I am here to listen, to learn, and to apply those things to enhance policies as we move forward. So thank you, and I'm glad to be a part of this work group.
Thank you, Director, and thank you, Isilda, as well. Director Ashenhurst.
Well, good morning. I am Debbie Ashenhurst. I have the privilege of being the director of the Ohio Department of Veteran Services. And as such, we run 2 veterans homes, which are nursing homes, but between the 2 of them, we have 129 beds set aside for memory care. So we deal in this every day, and I, as so many of you, have personal experience also. My father was a victim of Alzheimer's, so I lived that life, so I have a special place in my heart for how we treat veterans. And realize we just have a small portion of them in our homes, but veterans are a cross-cut of all of our society. And in Ohio, we're the 6th largest population of veterans. So I see the need out there. If it's in our veteran community, it's in all of our communities. So I think that what we bring to the table is experience in dealing with Alzheimer's, but also recognizing the need for further education, furtherance in the care and requirements to make sure that our seniors are cared for and protected. And of course, my particular interest is focused in the veteran community, but that does certainly extend across all populations. So happy to be here. Hope that I can contribute.
Thank you, Director. And lastly, Ombudsman Beverly Lobert.
Hi, everyone. Good to be with you. I'm the State Long-Term Care Ombudsman. I've been an ombudsman for 33 years. Our mission is to advocate for excellence in long-term services and supports wherever consumers live. So my interest in the task force is for us to identify some best practices, spread those across Ohio, including high quality care and robust support through home and community-based services. I'll be bringing attention to consumer experiences from the perspective of the Ombudsman Office statewide, and what we hear from residents and family members about their care experiences. I'm very interested in promoting individualized approaches to care and providing service, and really even changing our language for us to be approaching dementia in a more dignified way. My office is also represented on the Amber Alert Advisory Council as the advocate for an effective missing adult alert system. So I'm hoping that this work will improve that system as well. Thank you.
Thank you, Ombudsman Lobert. This now concludes our the formal introductions portion of our meeting. And Director McElroy, I will now turn this back to you. Thank you all so much.
Yeah, thank you for all those introductions. I know that took us a fair amount of time, but we wanted to hear from each one of you. We wanted you to appreciate who's serving alongside you. So this is more of an organizing meeting, this first meeting. And so what I'd like to do now is conduct an overview of the expectations, what we're expected to do. We're going to walk through Senate Bill 24, and then from there, we're going to set up sort of meeting cadence. We'll talk about that, what we think is going to work best for us. Any committee structure that we believe is necessary, essentially just organize ourselves so we can begin the work. So when you look at Senate Bill 24, and I believe everyone received a copy of it, but if for some reason you don't have it with you, I'm going to walk through some points here that are really important. And if at any time you have comments on that, please feel free to raise your hand virtually, and we can certainly be sure that you can that we can hear from you. So when you look at the overview of Senate Bill 24, there are three things that we're called upon to examine: the needs of individuals diagnosed with Alzheimer's disease or related dementias. The second are the services available in the state for those individuals. And the third is the ability of healthcare providers and facilities to meet the individual's current and future needs. Now, as earlier mentioned by Senator Wilson, there is a report that is due. That report must be submitted to the governor and the General Assembly, detailing our findings and recommendations. So if we can walk through what some of those findings and recommendations must specifically address, the topics. And those topics are pretty much within three buckets, and then I'll go into the detail of each of those buckets. The first are the trends in the state's Alzheimer's disease and related dementias population and service needs. The second is to look at existing resources, services, and capacity relating to the care of individuals diagnosed with Alzheimer's disease or related dementias. And the third is we are to examine and look at the policies and strategies around these things. So to go back to the trends that we are to look at include, but not are limited to. I want to make that really clear, because I do think throughout our work, if there are other things that are appropriate or related, I think we certainly want to be sure that we include it. But the trends in the state that we are to examine: the state's role in providing or facilitating long-term care, family caregiver support, and assistance to those with early stage or early onset Alzheimer's disease or related dementia. So there certainly must be an emphasis on the early onset. Second, the state's policies regarding individuals with Alzheimer's disease or related dementia. There are general policies. And the third, the fiscal impact of the disease on publicly funded healthcare programs. Fourth, the establishment of a surveillance system to better determine the number of individuals diagnosed with Alzheimer's disease and to monitor changes to such numbers. Those are the large trends that we have responsibility to examine and address within the report. Second, under the bucket of existing resources, services, and capacity, we are to examine the type, cost, and availability of dementia care services. Second, dementia-specific training requirements for employees of long-term care facilities. Next, quality care measures for residential care facilities. Home and community-based services, including respite care for individuals diagnosed with the disease and their families. The number and availability of long-term care dementia units or providers. The adequacy and appropriateness of geriatric psychiatric units for individuals with behavioral disorders associated with Alzheimer's disease. Assisted living options for individuals diagnosed with the disease, and state-supported Alzheimer's and related dementia conducted at universities located within this state. So there are 8 areas specifically called for under existing resources, services, and capacity. And then under policies, we have a pretty healthy amount of things we are to examine. The first, increasing public awareness of the disease. The second is encouraging improved detection and diagnosis of the disease. Third, improving the health care received by individuals diagnosed with the disease. 4, improving the quality of the health care system in serving individuals diagnosed with the disease. 5, evaluating the capacity of the healthcare system and meeting the growing number and needs of those with the disease. 6, equipping healthcare professionals and others to better care for individuals with the disease. 7, increasing the number of healthcare professionals necessary to treat the growing aging and Alzheimer's disease and dementia populations. 8, improving services provided in the home and community to delay and decrease the need for institutionalized care for individuals with the disease. 9 is improving long-term care, including assisted living for those with the disease. 10, assisting unpaid Alzheimer's disease or dementia caregivers. 11, increasing and improving research on Alzheimer's disease and related dementias. 12, promoting activities to maintain and improve brain health. 13, improving the collection of data and information related to the disease and their public health burdens. 14 is to improve public safety and addressing the safety-related needs of those with the disease. 15 is addressing legal protections for and legal issues faced by individuals with the disease. And the last is improving the ways in which the government evaluates and adopts policies to assist individuals diagnosed with the disease and their families. So you can see we have a significant amount of work, the breadth, the scope of the work, and clearly the depth of the work that we will have to engage in is pretty significant. Any responses or just reactions to what is called for within the bill? Okay. Seeing no hands raised, I think our next order of business now is to talk about how we will organize ourselves, and that is the frequency of the meetings, looking at a subcommittee structure, if there are additional experts that we should also include or have join us as part of maybe our subcommittees or just as serve as consultants to this group. So I want to open this up in terms of frequency of meeting. I have some thoughts of my own, but I'm certainly open to hearing from the other members of the task force in terms of frequency. Any comments on that?
Director, could you remind us when the report is due?
It's 18 months from the effective date, which was February 5th. So I think we estimated we were looking at about August. Is that right, Alex?
That is correct, Director. August 5th would be 18 months from the effective date of the legislation.
Okay.
We know that with COVID and the impact, the interesting thing about this is both, it was both something that slowed the business down, but actually, I think on the other side of this highlighted some things that I think will be captured within this report. And so we're looking at a summer time frame at this point. I thought I saw a hand up. Was that, give me just a second here.
Yeah.
Alex, I don't know if you're watching the hands. I thought that was Diane.
Yeah,
Diane, please.
Yeah, Diane.
It's Diane. It's Diane. It's one of my initial stupid questions. So, of course, with the pandemic, that severely affected the ability of this group to meet and begin its work. And so, is there any potential changes to what we've been charged with, or to the time frame that have been outlined in the legislation? Just figured I should ask.
Right. I think one of the things that we are looking at, if as far as time frame in the report, I don't know, Alex, if you want to address that, but I also want to make certain that we understand too, there has been one of our charges here at the department is have administrative support to help with some of the pre-work and some of the research, et cetera, that will also need to happen. So you will have some of that support as well to move some of these things along. So I want to be sure that that's understood, but we have talked about the timing of the report, and if it even necessarily is a situation where do we have maybe an interim and then a final. I mean, we've sort of played with this, but we wanted to have this conversation with the group. So thank you for bringing that up, Diane. Sally, I see your hand is up. Yes.
So I was actually wondering about the similar questions in regards to, what is fair and realistic for the department to do from a timing standpoint. And I guess that would probably dictate the meetings. The other thing I was, as I was listening to what you were talking about and just thinking about this ahead of time, I think that, potentially maybe there are some initiatives that have started already with the department with the with maybe possibly such things as the SAPA, as well as pre-existing work that's happened in the past. So is there some possibility that we could knock some of these out fairly? I hate to use the word fairly quickly because that seems, I don't know, a little naive or, rose-colored glasses, but I just wonder if there is some possibility to build on some of the momentum previously or that has been happening with the department even during COVID. So
that's a good point. And so I think those are some of the things that we certainly want to make sure that the larger group and then those particular subcommittees have access to and information about to be able to gauge. So for example, you bring up the SAPA, our Strategic Action Plan on Aging. We've worked very closely with the Health Policy Institute of Ohio, with HPO, and we've looked at our state health improvement plan. But what we've done is gone a step further to make it a bit more robust and very locked into older adults. And so within there's a lot of information around population health, where we are, where things set. That work, a lot of that pre-work and that background that we need has already happened and been put in a really good state where it could be used now. So I want to make sure you know that a lot of the things that we would draw upon, not all, but many, that a lot of that has been done. So thank you for bringing that up, Sally. Looks like I see your hand, Trey. I think it's,
yes.
I'm hearing someone on the phone who I may not be able to see their hand. Is there someone on the phone who's speaking?
Yes, it's Senator Wilson.
Yes, Senator Wilson.
May I speak?
Yes, you have the floor. Yes.
Oh, thank you very much. I'm sorry. I'm not in a position where you can see my hand, but I've had it raised. Anyway, I would say that this group, with your concern and compassion, would agree with me that with those that are suffering, it will be impossible, absolutely impossible for us to move too fast. So I would encourage you to move very quickly, schedule a lot of meetings, get these subcommittees working, and let's get on with the business at hand. If we don't think we have a complete report by August 5th, I'll introduce legislation to extend the date. But let's work toward that August 5th date because people need us to work toward that August 5th date. Thank you.
Okay. Thank you, Senator Wilson. Thank you. Looks like I see Trey Addison, your hand, Trey.
Yes, Director, I concur with Senator Wilson. I think that the more frequent we can meet and the committees can meet, the better off we'll all be in working for that August date. If that recommendation is, a monthly meeting of the task force and then simultaneously a meeting of the committees, that may make sense just to kind of get the process going. So I agree with Senator Wilson wholeheartedly.
Okay, thank you, Trey. Any other comments or feedback on that? Oh, Pete, I thought your hand was up. Is it coming back up? Did I miss you? I apologize.
No, I actually took it down. I think Senator Wilson has spoken, and we need to listen to what he's got to say.
Okay. All right. Any other comments on that point? So let's talk about then a potential meeting cadence. I did not see us meeting any less than monthly as a full group, but that would be with understanding that there were meetings taking place throughout the month with respective, with the different respective subcommittee groups. Let's talk about that, what's realistic as a large group, and then talk about how we could organize ourselves in ways that that makes sense based upon the scope of the work, so that we could work on different things simultaneously, come back, report out, and still have opportunities for feedback across the large group. So I will start us off then. I certainly have no problem with that. I do think that we obviously need a subcommittee structure. I think that the subcommittees would have the flexibility to meet no less than monthly and perhaps even twice a month, with the understanding that they're passing work back and forth across their membership. And then each month, the larger group could have opportunities to weigh in, offer feedback throughout. So I guess I'm putting on the table for consideration is large group monthly with subcommittees meeting potentially twice a month, and I think at the least once a month. Pete.
Yeah, I wanted to add something to that, and maybe it's getting ahead of where you were going, but I would like to suggest that we allow the opportunity for additional resource people to participate at the subcommittee level. Yes. To further expedite the work. All of us are one person apiece, and to really move this along, I think we might want to bring in more.
Absolutely, absolutely, and think we do want to talk about, I think was listed on here, brought up the consultants or other members or participants for those at that subcommittee level. Yes, absolutely. You're going to have to draw upon the expertise of many beyond just this group.
Hi, I'd like to echo that concern. This is Varun Mahajan. I've heard so many wonderful additions, whether it's community resources, caretakers, legal enforcement, and I have no doubt that our task force is going to be able to handle, advocate, educate, support. But none of our good work is going to be able to be done without medical experts who are actively treating Alzheimer's disease. And it's going to be crucial that we identify folks who understand that landscape of medical literature, research, clinical outcomes, if we're able to execute the third part of our requirement, which is the policies and strategies. So just my 2 cents on that.
Absolutely. Thank you. Thank you. Any other comments as we organize ourselves? And again, you can touch upon the idea of the cadence of the meetings, who we have at the meetings, and then a subcommittee structure we'll talk about here momentarily. Any thoughts or just general feedback? This is where
I know that there are some universities that, as we mentioned earlier, are doing great research. I'm most familiar with my alma mater and the Kent State Brain Health Institute that has received some grants to do some research in dementia. So I think maybe reaching out to some of the, I'm pretty sure Cleveland University, and maybe there was a Cincinnati, I can't remember which university it was in Cincinnati that does that scientific research beyond. I mean, we of course know about scripts and social gerontology and so on, but I think there is some great research being done, and maybe involving some of those researchers would be great.
So let's talk about the monthly meeting for the large group. I guess, are there any concerns or objections if we, right now we're sitting at a Monday, 10 to noon. Is this time frame pose any significant challenges, or is this sort of a day of the week and the time of the day that we can shoot for to get on your calendars? I'm seeing a thumbs up. Heads are shaking, nodding. Doug, I see your hand up. Doug Beach.
Yeah, this is our 04A meeting.
Okay.
I'm the new president. I had to beg off today. So if
so
we could,
it's hard for you. This poses a challenge for you, I hear. Okay.
So if we can just move it up a little bit, that'd be fine.
I want to hear.
Or is it the particular Monday of the month? Could we do it a different Monday? So it's not wherever this is.
Yeah, that's not a problem.
The second Monday.
Okay. So otherwise, if I can stay away from the second Monday, but keep Monday 10 to 12, are we okay with that?
Yeah.
Because that's what we're going to get out. We're going to get something out. Okay. So look for a calendar invite that will have Monday 10 to noon. We'll look to either the first, third, or fourth Monday. Okay. And we'll get that through August. We'll get that out to you this week. Okay. That's 1. 2. When we talk about subcommittees, I think I do want to say that before we even decide what these subcommittees look like, that there's an expectation that the subcommittee meets at a minimum once a month, and ideally twice a month. But I do think at a minimum once a month, there should be that touch point with that subcommittee. And I will, in the subcommittee, that subcommittee will decide, right, between whoever sort of is that point, that lead on that subcommittee and that group, you will decide and set whatever that time and date is. I won't attempt to do that. Just know that, again, there's an expectation no less than once a month, ideally twice a month. All right. So now I think part of the discussion is how do we organize ourselves with subcommittees? You know, I'm certainly willing to take away from this meeting and think about it, but I want to hear from you, your thoughts on the subcommittees that you believe we need in play to be as strategic and effective with all the work that we have. You know, on the one hand, and I'll just throw some things out here for us to think about and to talk about. On the one hand, our subcommittees could be organized by the expectations of what we are to examine, which are the needs of the individuals diagnosed with the disease, the services available right now, and the ability of healthcare providers and facilities to meet those needs. Now, those are some really big buckets, some big streams, and there's a lot that comes out of there, right? Mm-hmm. So that's one potential way of doing it. There is another way in which we can do it, in which we can look at it from the fiscal point of view, policy point of view. I think there are just so many ways. So I'll stop there to get feedback on when I read to you or sort of reviewed all of the work that we have to do. Did anything sort of jump out at you in a way to organize this business? Because again, we're certainly happy to and will at the conclusion of this meeting sort of step back, and we will certainly lay out to you the structure. We just want to get feedback from you before doing so. Jean, I see your hand is up. Jean Thompson, you're up.
Certainly, we could organize the way you first suggested, Director McElroy, or we could go to your buckets that you already identified earlier. Those big buckets of the trends, etc., the existing resources and the policies and strategies. I mean, those sort of encompass all those 3 points that you stated to begin with. I mean, my thinking is either one of those works, although maybe the big buckets is more inclusive of broader concepts than just in the first 3 bullet points that you gave. And then, I mean, my sense is once you would actually establish what subcommittees you're going to have, then I would, from my perspective, I'd let people think and join where they feel they have the most expertise or information to provide.
Okay. Thank you, Jean. Jennifer Blau.
Yes, I think additionally, I like the idea of organizing based on the product that we need to produce. But I also think that we ought to categorize within each one what we need to do for caregivers, patients, the medical community, et cetera, because I think that if we're not cognizant of our individual constituent groups, we may have a lot of overlap in our ideas as we're working through the actual proposal.
Thank you. Thank you. Melissa Schiffel.
They pretty much.
And good to see you, Melissa. Good to see you. And here you're still fighting a good fight. Go on.
Both of the previous people have spoken. Perfect. I agree with that.
Okay. All right. Pete.
Excuse me. I was going to say that I think having the three groupings that you originally said, the needs, the services, and the ability of providers and facilities to meet them would be good overall division of the work. Given we can't subdivide it too much because of the time frame. And I think that probably the next step would be to take perhaps the 24 or whatever it is, 26, 28 different topics that are supposed to be addressed, and put them into one of the three groups so that they can stay focused on the product, as I think someone said. Now, that's not to say that there couldn't be other things that each group looked at, but we want to make sure to address all of those items because that's our responsibility.
Thank you, Pete. Thank you. Any other comments on organizing the subcommittees? Okay. All right. So I think I've gotten really good feedback here. And again, this is something that we will push out this week, sort of the way the subcommittee structure will be set up, along with the frequency of the large meeting and the subcommittee meetings. Again, those exact times and dates of the subcommittees will be set by the members of the subcommittee. I think what we're going to have to go back and do, which I'm not prepared to do at this moment, is to find a way for you to indicate your interest and to be sure that we have balance across those groups. So we're going to be focused on interest and balance, make sure we have the right expertise, and to also find how we can learn who else or how we also be certain that we capture expertise from across the state and not just limited to those of us on this task force. I think in addition to having people maybe participate or that you consult with as a part of the subcommittee, we as a task force are going to have to be really thoughtful in how we engage the public and engage others to provide us with feedback for the benefit of the entire group. So we'll be thoughtful about that as well, and how we integrate that within our process. Catherine, I see your hand up. Catherine Broke.
Yeah, this actually ties right into what you just said. As I was looking through the policies and strategies and thinking about who we have on the task force, we obviously need someone, and we have people who have a good background in professional development and how we can really educate within our provider space. But what I don't see among our task force is somebody with really strong communication skills, because a key part of what has to happen through this is that we're educating the public, we're educating, going back to those comments I made about the community at large. So I don't know, maybe that's just embedded within the agency and we can take advantage of resources that are already there, but it may be that there needs to be someone who really brings that skill set to our work.
Now, I think that's a really good point, Catherine, and not only just in terms of the skill set, but one of the things that I have taken note of is that we too must have, just across all of the groups, right, some sort of guiding principles, some sort of things that are embedded just across. So I think strong communication, good communication, who we communicate with, how we communicate, like all of those things also to me fall within that stream that has to run across all of the different groups. So thank you. Trey Addison.
Yes, I agree with that. I think one of the things that we've seen in other states is that they didn't do that. So again, I think going to Senator Wilson's point that he made a number of times, even prior to the task force, is looking at and reflecting on what other states did not do or did not execute on. I think the public messaging component is huge. And even post task force, how are we communicating to the public on what's going on with the task force, as well as what the outcomes will be. As well as I think just utilizing research to try to drive some of these committees, I think is going to be big. So, one of the things that we could do is, use current research that's out there. Obviously, as an association, we have that, and we have resources across the state that we can use to drive some of the committees that we have through the task force.
Thank you, Trey. Thank you. Any other comments or questions on establishing the task force cadence? Again, when we will meet, how we will meet, how often we will meet, and who else can join us as we meet. Okay, so then the next piece is around procedural expectations, and essentially here, what we wanted to point out, and again, we will push out, there are a few of you who have, I think, participated on like our council and other pieces, but for those who are not familiar, we typically use a share file, and we have a way that we are able to communicate information to you. And we also want to be sure that we have a way for you to share information with us. So we're going to stand up a share file or some sort of system that is dedicated for this task force so that you can pick up information, add information, and also be able to track and see any edits to information. So again, that's something, and so there'll be an expectation that any communication related to that or with that, we will use that sort of formal channel and how we manage the work stream. So I wanted you to be aware of that, and you will get, I think we typically send, there's like details out or something about how you use it, how you access it, how you log in, what credentials you need, etc. So that we're really clear what's dedicated to this work. So the other thing is we'll also have to, and hopefully we'll have this by next meeting, we'll be really clear with you on communication and how this group is represented. It's really important, particularly as we begin to move down the stretch, that we're very clear that who speaks for whom and who represents whom in all of this. And so we want to be sure that you have clear understanding and guidance of that as well as we continue with this work. Alex, have I left anything off for procedural expectations or anything? I think that was generally what I just wanted to hit upon, unless there's anything else I've left out.
Director, I believe you've covered it all.
Okay, so then lastly, we have general announcements. We want to make sure that this is on every agenda. There may be things going on in your respective organizations or just in your areas that you think are really important. I guess the announcement that I'll make is, which you've probably heard, but we've been working really, I think, really hard and fast on vaccination efforts across the state. And if you didn't hear, right, the news flash is that next group up, right? Next group up, our sort of 1B group, will be those 65 years of age and older. And the hope is beginning the week of the 18th that we'll start rolling out with those 80 and older first. And then we'll move out every sort of 5-year increments from 80, 75, 70, and then 65, with the understanding, as you know, that there are limited amounts that come in each week. And so trying to be really thoughtful about how that is done across the state, but just wanted you to be aware and to be sure that your respective groups or constituency are also aware that we are moving toward that 65 and older group for being vaccinated. Any other announcements or anything from others? No weddings, no anything, no virtual weddings, I should say. Nothing happening. Well, you know, I'm always very cognizant of people's time and and when you dedicate your time, I want to be very sensitive to that and respectful of it. So unless there are any other comments or questions, I will say you should look for a lot of information to come out from us here this week as we get organized to get this work done. It's really important work. I'm really excited. And again, seeing no comments or questions, I want to thank you and look forward to talking to you again soon. We are officially adjourned. Thank you.
Thank you.
Thank
Bye-bye.
you. Bye.
Thank you.
Bye.